This stitch we're going to be doing now is a series of different ways of approaching redundant skin, or what we call dog ears, or since I like dogs, I call them cat ears. But in other words, you've closed up an opening, and you notice that when you do that, there's little bits of skin at either end. Okay? When you come across these extra bits of skin, this is actually redundant tissue, and typically it's because if you made a fusiform or elliptical excision, as it's commonly called, we like to have it be on a ratio of the length being 3 to 3.5 times the width of the incision. If that's done properly, you don't tend to develop these little lumps on the tissue. As I'm sure you people are aware, with pig's feet, they tend to occur more frequently, but this is kind of what tends to happen. If you make it less than 3 to 1 or 3.5 to 1 length to width ratio. So if that does occur, and even if you do it properly, sometimes you can still develop these things. We need to have some way of dealing with this little bit of extra skin that we have on either side here. So I'm going to show you several different ways of taking care of these lumps, so to speak, on the skin. And the first I'm going to demonstrate is what we call basically the simplest and the easiest method for doing this. And let's say, for example, this is obviously a lump on the skin surface. And this lump, as you notice, is equal on both sides. In other words, the lump, here's my incision line, the lump extends equally on this side as well as on this side. This is called a bilateral dog ear versus a unilateral dog ear like here, where you can see that most of the lump appears to be just on this one side, and there's almost none on the other side. So if you have a dog ear that does have a bilateral dog ear, one of the easiest ways of taking care of this is to make an incision down the center to the end of the actual dog ear. And you can see that this excess skin goes from here all the way up to this point. Okay? If you stop short and control it, you can end up with another dog ear, which will require to cut some more, and cut some more. Pretty soon you'll be doing the whole pig's foot. So what we like to do, the best way of doing this, certainly on human skin as well, is to make the incision down the center, okay, all the way to the end. And here we may have some trouble because of the cut in the skin. But the idea is to basically cut down the center, and you have a lump, an equal lump on either side. And then the easiest way of handling this is just pick up the skin on that side that's hanging over and cut whatever goes from this point right here back to here. Cut whatever is hanging over. Okay? And when you do this, try to do it by not pulling too tight on the skin. If you pull too tight on the skin, instead of getting a straight line, you're going to get part of an ellipse in here. You can notice just a little bit of a point right here, and that's usually fairly common. And I usually just take a pair of scissors and just snip it off with a pair of sharp iris scissors, which we don't have here, unfortunately, but this is the best we can do. Okay? So I've taken care of this side. I'm then going to pick up the skin over here and just gently pull it across and cut whatever is hanging over that line. Okay. Okay, and again, I notice there's a little bit of a point here. So I'm going to get my pair of scissors in here. And again, lots of times in real life scenario, it's easier to almost cut it with a pair of scissors than it is to try to cut it away with a pair with a scalpel blade. So you want to cut it back like that. Make sure the edges are nice and smooth, or as smooth as you can make them. Turn them back again, and now I can go ahead and pull this together, pull each side together, close it up, and as you can see, I'm not going to actually put any stitches here, but you can kind of see basically when I close it up, pull the skin together, I've taken care of this dog ear on this one side. Okay, so this is where you have a bilateral equal on both sides. You cut down the center to the end of it. Notice there's no lump at the end. That's pretty much been taken care of. And this is what you're shooting for. So you have to cut all the way to the end of the dog ear. Do not stop prematurely. So in this scenario, I've closed it up. I can stitch it back together again. Everything should be fine, and should heal up fine without a lot of scarring for the patient. If we have a dog ear or a cat ear, where you can see here, which is pretty much on one side, what we do here is we basically extend the incision line to the end again, like you did before, okay? And then I'm actually going to cut upward at an angle. This is called a hockey stick. And the reason I'm doing that is this lump is lumped up this direction, and it's also lumped up this direction. So by cutting along one side here, I've taken care of the lump on one side. By cutting up at an angle up here, I've taken care of the lump on the other direction, so this direction versus this direction of the lump. I then typically like to go back and mark where my lines are. So in other words, here I can see a line here, and I'll take a marking pen, a sterile marking pen, and I'll put a line on the skin here, and I'll put a line extending out past this point as well. And the reason I'm doing that is when I pull the skin across to remove it, I'm pulling it diagonally across both sides. Can I tell where my lines are anymore? My lines are totally buried, so I have no idea where my lines are anymore. By putting my lines here, I know I need to start from here, going straight down along here to follow where the actual line was. We'll just go ahead and cut down there. Okay, see this is not necessarily a big area on this side. And over here then, I'm just going to gently pull it across, and I'm going to cut along this line from here directly back to there. And again, be careful when you cut. You don't want to pull the skin too tight. And make sure you don't go back and actually cut your initial stitch as well that you put in the center of it. Okay. Okay. There we go. And we can close the skin up back like such. Pull this section of skin over the top like this. Close it up, and that takes care of our second dog ear. So these are the two probably most common ways of doing this. Okay. And you want to go ahead and turn this off? Ready. Okay. So we're going to look at two additional ways of doing the dog ear repair or the cat ear repair. Remember, we did the first one, we just cut down the center and then pulled the skin over, or we basically just did the hockey stick. There are other additional ways, and these are not all the ways that are available. These are just some suggestions of ways of taking care of these, but this is a very creative process, and you need to realize with all of the stitching we're doing this quarter, it's basically working with the tissue, moving the tissue around, playing with the tissue, and doing what the tissue requires to heal up properly. So always keep that in mind. This is a very creative process. So we're showing you some typical ways of doing it, but there certainly are some other ways of doing it as well. So we have this one. We have a lump on this side, which is pretty much equidistant on both sides, and we also have a lump on this side as well. And let me just go ahead and show a couple of different ways. One way is, which works fairly nicely, is what I like to do is just pick the skin up. So basically bring it up nice and even so I have both sides evenly. And then what I'm going to do is I'm just going to cut an elliptical excision across here, trying to keep this back edge pretty straight so I don't end up with a little point here coming up. There we go on this side. I'm going to go around to the other side, kind of cut around. So I've cut along this side, and I've also cut along this side. Notice when I pick the skin up, the skin is not laying flat. It's actually kind of tipped up at an angle, or tipped down on the other side. And when I put my scalpel in, I'm turning my scalpel at an angle, so I'm still perpendicular through the skin. And that's important to do. Now this is going to be a little tricky here at the end. There we go. So I pop it out. Okay, cut out the excess tissue. And again, at this point, all that we have now is an elliptical excision, which I can go ahead and pull across, snug up both sides, and pull across like such, and basically close up as an elliptical excision. So I can take this side, pull it across, close this up, and we basically have taken care of it as an elliptical excision. So that's a simple, easy way of doing it. Another method that we have that works fairly well is to, instead of making elliptical excision parallel to the incision line, make it actually 90 degrees to the actual incision line itself. So on this side, instead of doing that, I'm just going to basically do an elliptical excision here, coming across, catching the dog ear to some extent here, coming on the other side, and I'm going to actually use my pair of forceps to kind of hold the skin a little bit, control the movement of the skin, come around and actually come in like such. So I've made an elliptical excision, but it's perpendicular to the actual plane of the actual incision line. By doing that then, close this up, and basically undermine the skin as necessary, and then I can take this piece pull this piece of skin back across to match up with a 3-point or 4-point corner stitch, excuse me, to pull these two together like such, closing up like such on one side. So you can see that close up very nicely. Okay, so this is another way of doing it. Notice there's a little bit of a dog ear here. On a real person, that probably would not be a problem, but with the pig skin, you will tend to notice that. But this is another alternative. And so these are the 4 most common ways of dealing with redundant skin or dog ears or cat ears. And there's certainly, again, this is open certainly to your creativity. Kind of pull the skin like such, and then pull this piece across as well to kind of close it up. So it's open pretty much to your creativity. But these are our ways of handling the redundant skin, and I'm sure you will find something that works for you. The method doesn't matter how you do it, as long as it closes up with a minimal amount of cutting wherever possible, and there's no lumps or bumps left in the area, and the edges come together clearly. And again, as always, make sure you try to get a little bit of skin eversion wherever possible so that the skin will heal more properly. So that takes care of dog ear repair.